My first question for you, Dr. Sagar, is there still scope for dental practice in India?
The scope of Indian dentistry, and this big word scope should not be attached with certain degree or with certain profession. And why I'm telling you so, you have to understand. This word should be attached to an individual. Whenever people ask me that what is the scope after BDS sir, should we start the clinic or should we go for PG or should we go for PG in this particular subject because other people are doing this, I always tell them that scope is not something which is related to this subject or with this profession. Scope is something which is related to you. If two people are getting out of same college with same qualification, with same desire for a successful practice, that doesn't mean that both of them will get successful practice. One of them will, who will be loving that subject, and one of them will not. Right? Similar things happen in selection of PG also. People select the PG subjects according to the preference of society. People feel that this person is getting more successful after doing PG in this certain subject. For example, oral surgery or ortho. I'll do it. Although I don't like it, I don't love it, I'm not good at it, but I'll do it. Right? And after that, they are poor oral surgeon or poor orthodontists. But a person who know that I am good at oral pathology or any non-clinical branch, I'm not saying you should not go for oral surgery or ortho. If you love it, go for it, but be the best version of it. So if you know that alright, I'm good at oral pathology, I'll read it because I love it, I'll do PG in it, and I'll do every possible thing to learn it as much as possible. Now the scope of this person is higher. Why? Because he or she is good at it, and they will give exams even in USA or UK or Australia or India, wherever it is. They'll get 100% assurance that you are selected. We want you because you know things, you're good at it. So if you are good at one thing, automatically scope increases. And if we think about clinical dentistry, guys, come on. You are educated people. You need to understand that जब तक patient को दर्द है, wherever there is pain, wherever there is a live tooth, dentistry scope will be there. And if you will talk about saturation and that there are so many dentists nearby, even if there are 100 dentists nearby, there are thousands of patients. And trust me, these 100 dentists, out of these 100 dentists, only 10 dentists are doing good. 90% of them are not very good. It's unfortunate, but it is true. So you have to be in that 10 people. And for that, what you have to do, we'll discuss it later also. Right? So the scope word, always remember, is associated with individual. Be that individual. Select your dream with your mind and wisdom, not by copying others. Not just because something worked for someone else, that doesn't mean that will work for you, or it will not work for you. You have to see that you love it or not. If that is an amazing orthodontist, you can be an amazing orthodontist just only when you love that subject. Always remember this.